Bronchiectasis is an abnormal and permanent dilatation of bronchi. It can be congenital or acquired. It leads to the chronic or recurrent infection in the dilated bronchi with copious sputum production and the hemoptysis. It can be of various types. First, the cylindrical type. In it, there is the uniform dilatation of bronchi. In fusiform type, dilatation is irregular with the tapering at both ends. In secular type, there are multiple bulgings from the side wall of the bronchi. Causes of bronchiectasis. First, bronchial obstruction due to foreign body tumor, stenosis, etc., or the infections which can be like childhood pneumonias in measles or pulmonary TB, or other causes can be cystic fibrosis or alpha-1 antitrypsin deficiency. The patient of bronchiectasis represents with recurrent cough or copious of secretion through the respiratory tract, and some patients may have no sputum with cough, and this entity is called the bronchiectasis sicca. Sputum is often blood-stained and occasionally the foul-smelling. Hemoptysis can be massive due to the erosion of the hypertrophied bronchial artery. Patients may have dyspnea and wheezing. Patient may, if there is any secondary infection, then the quantity of sputum increases and it becomes more purulent and more foul-smelling. And patients may have fever, or patients are usually malnourished, and a child can be growth retarded. On physical examination, coarse leathery crepitations, rhonchi or bronchial breath sounds over the area of bronchiectasis is seen. Investigations carried out are chest X-ray, bronchography, HRCT or bronchoscopy, or pulmonary function tests are done. Complications of bronchiectasis can be massive hemoptysis, respiratory failure, pericarditis, etc. The management of the cases of bronchiectasis is done by the drainage of the secretions, expectorants is done. Then bronchodilators are given. Along with them, some antibiotics are given to treat the infection or infection which is leading it to the bronchiectasis. Then if secondary infection is suspected in the patient, then the broad spectrum antibiotics such as ampicillin or amoxicillin are given. Metronidazole can be added if anaerobic infection is suspected. Then the surgical resection is considered when bronchiectasis is localized and the morbidity is substantial despite the adequate medical therapy. Bronchial artery embolization can be considered in the patient with recurrent large hemoptysis.